skin tightening devices, it can be a real minefield trying to understand which devices actually can help to provide some skin tightening and which ones might be right for you. So I'm going to do a little bit of a run through, and also some devices are grouped together based on the technology they use. So let's start with radiofrequency microneedling. So this can involve many different devices. So for example, we have the Profound RF by Candela. The Morpheus 8 is one you'll have heard a lot about, and I'm really excited about the Profound Matrix Pro, which is going to be launching into the UK this year, and I am very excited to be having a play with because I think it's very different technology. So these devices combine radio frequency with microneedling. So it involves the firing of needles where at the very tip of the needle, the energy, the radio frequency, can be transmitted into the tissues. So essentially you're bypassing the surface layer of the skin to deliver the energy where it needs to be to really, really work. And all of these devices do have differences, maybe in the depths of the needles, in the thickness of the needles, in the number of needles, in the temperatures reached, for example. So there are differences between all of them, but they can be extremely effective devices. So for example, the Profound has studies which show that in the lower face it can deliver the equivalent tightening of about a third of a facelift. And the Morpheus 8 is really well known for providing nice tightening and skin improvement results even around the more delicate eye area. So they can be a great modality to use, but it can be a loud space with lots of different devices, and just because it's radio frequency microneedling doesn't make that device a good one. It can be very, very difficult to unpick. Ultrasound technology, and here again we have a lot of differences. So you'll have heard me talk an awful lot about softwave, but how does that compare to ultherapy or HIFU, which many people have heard of? Ultrasound devices started with, ultherapy was the first one, and ultherapy uses micro-focused ultrasound. So you're envisioning using an ultrasound device and the depth of particular layers of the face. You then fire a targeted beam of ultrasound at that particular layer. So that can be the SMAS layer, or it can be within the skin, or it can inadvertently also be in a layer where we don't want the energy to be. That then provides collagen stimulation and some tightening that can lead to visible lifting. HIFU follows a similar process but is less targeted. It usually doesn't involve visualizing beforehand, so maybe has less accuracy. Softwave, the only similarity is that it uses ultrasound. It uses it in a very different way, something called parallel beam technology. So you're targeting the energy just at 1.5 millimeters, so purely within the dermis. It doesn't go into the deeper layers of the face, and it delivers more energy than the other devices, even around 6 times more energy per pulse, and provides, in my opinion, the best lifting and tightening result I've seen, including around the eye area. When it comes on to other devices, we have radio frequency either monopolar or bipolar or multipolar devices. Now these use radio frequency without the microneedling component. They can give some nice results, but often involve having multiple treatments, so courses of treatments, and without maintaining those, the results are less long lasting. And the key difference is that for most of these devices, and there are exceptions, they're heating the skin to a much lower temperature, so between 40 and 45 degrees compared with softwave, which is between 60 and 70 degrees, or Profound, which is 67. So we're achieving a much lower temperature, so the effect on those collagen and elastin fibers is less. It's denaturing them, or sort of causing a more transient damage that's healed very quickly compared with the more intense denaturation that the higher temperatures achieve. Lasers can also give quite effective skin tightening, in particular when you're looking at CO2 lasers. And we can see this visibly if you look at videos of CO2 skin resurfacing. You can see the skin contracting as treatment's being performed. And these are reaching very high temperatures and using water as a target for the laser within the skin. The offset with laser is with these types of lasers, there's usually significant downtime involved. But the results can be particularly impressive, especially if someone's got more advanced skin laxity. Then we have other devices. So in this group, things like Tixel, which uses heat. It uses this ceramic plate that directly is heated to very high temperatures and can cause good improvements in skin texture and some nice tightening around the delicate eye area in particular. Or Plexa, which many people talk about, using plasma to cause these targeted, what looks like small burns, I guess, essentially, but is where parts of the skin have been vaporized, allegedly leading to a tightening result. I've seen some really nice has results with Tixel. I have to say with the Plexer type plasma treatments, I'm yet to see results that really convince me. Immediately after treatment, they can look good, but as the result settles, I've found them much less dramatic and usually requiring a course of treatments. There are other plasma devices like the Neogen and the AgeJet, which I'm intrigued by and excited to discover more about. As yet, with regards to skin tightening, I need to see more results myself. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.